Dr. James Ahimbisibwe is my name. I'm the CEO, the founder of Keah Medical Investments that came in 2009, 2013, fully registered as a limited company. This came up out of an outcry in the community that I was staying as a tenant. It was then that I was a staff of Cardiac Hospital, and by then that's where I was serving from. And during the times I was working at Cardiac Hospital, I was also an internee, junior doctor at Mulago Hospital. One of the residences around this area of Keah identified me, and by then she was admitted at Mulago Hospital to be awaiting to be operated on. So she identified me, we talked, and within a week's time, I realized that I had so many guests at my residence, my rented room. And this is how Keah Medical Centre started. Being a staff at Cardiac Hospital, we were called by the management team of Cardiac Hospital, and the meeting started, and the purpose or the core purpose of that meeting, the directors wanted to send their views, to send the information to their employees about how the business wasn't doing well and how we could adopt other ways of our family incomes. So to me, by then I realized an opportunity that maybe I would start the similar business within the area of residence by then, given the purpose that I had already so many residences at Keah Medical Centre that had identified me as a health practitioner. What I did was simple. I had no money, no savings at all, but I remembered that I could really make a move and find a health facility within the area. Keah Medical Centre is one of the residences at Katwe, and that is definitely the midst of several slums where you can easily find low-income earners, or what you call urban dwellers. So what I did was very simple. I had to move into Centenary Bank. That definitely reasoned with me on how I could buy extra equipments to start a health facility. We had to move in, and I rented a room, a two-room business area within the street of Keah Medical. And then I recall having moved myself to the timber shop and negotiated those timbers, and then the carpenter came in, and I developed an idea with the carpenter how I wanted a health facility to look like, so that we can model a dispensing section versus consultation room with a waiting lobby in one room, so that the next room may serve as an admission room, and which we did. So the three departments were in one room. The second room was admission, which we didn't have the beds by then, and then the next store served as a laboratory department, which didn't have a microscope or any equipment. So this is how Keah came up in 2009. There is nothing big that drove me to this, but an outcry that I found at Keah Medical Centre, a village of Katwe, that I found really so many mothers were footing in search of maternity services at Mulago. So many mothers could even reach at Mulago searching for antenatal services and fail to be attended to because of the numbers of the mothers flocking to Mulago for such services. So many people could even move on foot to Mulago searching to get consulted by the doctors, but they could not get by then. That is 2009, 2010. So I realized that coming up with such an idea within the area that I was a tenant would definitely solve many issues and mostly problems in the health sector. Keah Medical Centre, Zambia, Keah Medical Investments, Uganda Limited, has really a big story to tell, and it's back. My being a health worker, myself, I'm a general practitioner and a registered medical officer in Uganda that I've served since, I think, 2011, when I finished my undergraduate, 2012 internship, and 2013. I've served in different areas, that is Keah Medical Centre, Cardiac Hospital, and other related private sector healthcare facilities around Kampala. I've not yet moved out of Kampala. And out of my movement has really taught me a lot. The birth of Keah Medical Centre, purposely at the midst of slums of Kampala, Katwe, was a revelation that came up to solve a situation of a story that my mother told me. I'm the only health worker that came up as the first health worker being born in our family. That was my first undergraduate. But as I talk, we have many so far that have followed my training. But out of this, my parents told me how it was hard for me to come to life. My mother spent almost 4 days laboring, and they had no midwife that was caring for them. And most of my siblings definitely were being helped by a traditional birth attendant. Nevertheless, when I was in primary 4, I got ill of malaria. And by then, from the school was given permission to go to the health center for, where I reached and realized a bigger queue that was leading to see a doctor. And those were patients by then. We had to wait over around 30 to 40 patients to see a doctor. I had high-grade fever, chills, and I remember as we collapsing from the line. By the time I was close to around 3 individuals to see a doctor, we were informed a doctor left for lunch. That was around 1 p.m. So we had to remain in line for over 2 hours, waiting for a doctor that had left for lunch. And after lunch, the line continued, and I got a chance to see a doctor. The most heart-aching moment was to realize that a doctor seeing him was only to see him asking me questions, which I did reply, and I was sent to laboratory without an examination. So at the laboratory also I found a long queue. I had to wait as a young man. I remember it was P4 around there, and it wasn't good for me. I remember collapsing from there, and the nurses helped me, and that was the end of seeing a doctor again. So the next day, I was taken back to a different health facility where a doctor had to examine me and revealed that I had severe malaria. Healing from such a moment gave me a backup plan of saying, if given a chance, I would take to one of those 2 courses. One, I would become a priest that I can tell the world about this situation, or become a health worker to be part of the fight, to see how other individuals, kids of such a nature, mothers, and even elderlies would at least face and have rights to see health workers on the right given time and be served right. So one of the main purposes of Keah Medical Centre is, one, to see us serving more and be the leading service provider and whatsoever the most affordable healthcare service delivery within the region and in the areas of such communities. My mother told me I had around 4.9 kgs. My mother was carried on a bicycle, and the bicycle was borrowed from my uncle, where my dad and my uncle, 2 uncles, had to push my mother up to the health center which was around close to 20 kilometers, and that was definitely in 1983. At reaching the health facility, she spent over 4 days without seeing a midwife. So the midwife that passed by told her, this baby is too big, you may not push this baby. And that very night, that's how I came to be born. And also with such kind of illnesses that we could get, and I said, no, I have to do this, at least to save more. And indeed, Keah Medical Centre from its birth, 2009, we have saved many. It's not about how much you are going to pay to the services, but about whether the services you have got them. Being an entrepreneur is not a challenge, but it's a journey that I've taken. And I would say to me, I normally call it a course that every day I learn new things. Looking at it as a serious business was around 2013, and then indeed that's how I made a step to make it possible that the facility or the business is registered. But before that, still, I've been integrating, looking up to making it possible that it can be a business alongside our service delivery. But we have always been focused on service delivery first. It's not a simple move to take to run a healthcare facility, I should say, in Uganda, first of all, one of the major challenges that you face is having the right equipment to serve a human being. Most of these medical equipments, I should say, in surgical end, maternity ends, they are very extremely expensive in Uganda. And for such a matter, I was once told that some of them are even taxed for you to own them in your health facility. So, secondly, first of all, the most important raw materials that we use in service delivery is the drugs. So most of those drugs, we always find them very expensively, and at the end of the day, they run a very big role to make sure that our clients get better. And then the third one is about the human resource, that also hiring specialized healthcare service providers, the medical consultants, very well skilled nurses, very well skilled laboratory technicians. Talk about radiologists and all those, always found it hard, to pay their salaries and move a step to retain them, work and serve the community. I remember during my Christian journey, I was once told Jesus was born. So I would also answer this, that TBN was born in our life. Wow. I remember the days when one of my colleagues, that colleague of mine is also a business owner and, for such a matter, a medical practitioner. During the COVID times, told me, you know what? I know you're struggling a lot with your business at the moment, but here comes TBN, that is training health workers and other business owners to know how to deal with business during the COVID times. I can't lie, to me, at first, I looked at it as a hawk. I did not give it time. We were always trained online, and most of the times during those times, it's when I always look at my patients first. I say, I cannot give attention to my phone first. No. I have first of all to take care of my clients, then look at the phone. Then I remember one of the staff of TBN could even call my name during that session. Dr. James, please, you're missing here. Do you have anything to say? Most of the times I would look at the screen, smile, and then put the video off again, take care of my patients. So those are one of the first moments that I really realized that maybe I missed most of those trainings the first time. But I can say most of very important times that I really gave myself to learning, every bit of learning was really a sword to my heart, to my mind, that I was missing to understand ways on how to handle my businesses and look at the future of the businesses. I've gained a lot from TBN trainings. I've been guided right by the TBN itself. Out of these trainings that they always carry out, I've really attended most of them physically, and I can say out of these trainings, the first training taught me a lot, mostly on how to develop structures for the business to grow. So for such a matter, I remember that is when I realized I was missing someone to manage our accounts. So we had to move in with my teams of directors, and we elected an accountant report. And since then, we realized our flaws on how we were managing and the mismatches that we had with the service providers. I have never dreamed beyond serving a community, and in all my business accounts, social medias and the rest, I've always told people, I'm a community servant, and in such a capacity, a business owner, and in such a capacity, I've never departed myself from the community as a medical doctor. So, Keah Medical Centre itself, I'm looking at definitely by such a period of time having reached up to the peak. And the peak in such a matter is to see the rest of these missing gaps in terms of departments serving the community. First of all, we have referred very many clients in search for consultants of the eyes, what you call optic. We have referred so many clients in search for mental services. We have referred so many clients in search for x-rays. We have referred so many clients in search for major operations like ENTs and the rest. So this is where we are looking at. If we, by that kind of times, we should be in capacity to serve them in-house within ourselves at Keah Medical Centre. Keah Medical Centre started with I myself and one nurse. I still recall that I was paying 35,000 a monthly salary. She was pushed to stay inside the clinic, and that's why she was sleeping, and she could work as a nurse, accountant, a lab technician, a cleaner, and the rest of the works were done by her, apart from me joining her early morning, and we pushed together up to the rest of the day and the rest of the 7 days. So she had no off at all, and the rest of those that comes about as an employee. At the moment now, I can give you a revelation that Keah has capacity. We have over 14 salary earners that we have employed that receive salaries every end of the month, and also have around 9 staffs that receive wages, and those are part-timer workers, starting from non-medical and also medical service or healthcare service providers.